Hello ladies and gentlemen, good afternoon. My name is Michael Chege and I'm presenting our research on cancer burden and service accessibility across Europe, a comparative analysis based on 2023 European Social Survey data. When we think of healthcare in Europe, we often assume a generally high standard of care across the continent. However, our study uncovers a more complex reality, a landscape defined by pronounced and persistent disparities. For this particular study, we wanted to move beyond the general mortality statistics and look at patient experience. The primary objective of our study was to conduct a cross-national comparison of cancer burden and healthcare accessibility across Europe. We analyzed a robust dataset collected through the 2023 European Social Survey. Our variables of interest were self-reported current or previous cancer diagnosis, self-reported years lived without cancer for individuals diagnosed with cancer previously, and ability to obtain medical consultation or treatment within the last 12 months for individuals diagnosed with cancer currently or previously, in a person's country of residence. To ensure that our findings were generalizable, we employed weighted descriptive post-tabulations, weighted chi-square tests of association, and weighted logistic regression analysis conducted using SAS version 9.4. Cancer prevalence was significantly associated with a person's country of residence. Individuals having reported cancer currently or previously were as many as 40.0% in Montenegro and only 3.3% in Iceland. A person in Montenegro had 7.42 times higher odds of reporting cancer currently or previously when compared to a person in Iceland. Years lived without cancer for previously diagnosed individuals were also significantly associated with a person's country of residence. Individuals having lived more than 10 years without cancer after having been diagnosed with cancer previously were as many as 55.5% in Latvia and only 25.5% in Cyprus. Access to care was also significantly associated with a person's country of residence. Individuals who were unable to get medical consultation or treatment within the last 12 months after having been diagnosed with cancer currently or previously were as many as 38.8% in Serbia and only 4.7% in Switzerland. A person in Serbia had 12.81% higher odds of being unable to get medical consultation or treatment within the last 12 months when compared to a person in Switzerland. The study therefore concluded that there is pronounced and persistent disparities in cancer burden and access to healthcare services among current or previous cancer patients across countries in Europe. While some nations enjoy a relatively low cancer prevalence and strong access to medical care among cancer patients, others face a dual challenge of higher cancer prevalence and limited access to care among cancer patients. We therefore recommend promotion of cross-border collaboration, shared best practices, and coordinated European cancer control strategies. Cancer does not respect borders, and neither should our solutions. We also recommend further research conducted using causal inference principles for identifying causes of disparities in cancer prevalence and access to care across countries in Europe. Thank you very much for your time. For more information about the study, please visit poster P13. My contact information is listed at the bottom of the poster, and I'm happy to take any question.